Well, I'll go ahead and take the opportunity to introduce Dr. Kumar. If you're ready.
Yeah, let's go for it.
Okay. Well, Dr. Kumar is a person that I've gotten to know really more virtually than in person. We've had a few in-person visits over the last few years, but since I moved to Arkansas in 2009 and have been interacting with the community, whenever there was a question that has come up about either child psychiatry or addiction psychiatry, either I knew to ask Dr. Kumar directly, or someone would say, well, ask Dr. Kumar. And he's always been extremely helpful to me, whether I was needing information that was knowledge facts about addiction or resources. And so recently at our Arkansas Psychiatric Society annual conference in April, he was a speaker on this topic about medical marijuana and the latest. And so I was like, we've got to get him for ABIN. So I will say a little bit more officially about Dr. Kumar. He's a board certified psychiatrist with fellowship training in child and adolescent psychiatry and addiction psychiatry. So that's kind of triple boarded. Particular area of interest of his is in adolescents and young adults with addiction. He was previously with UMS, but has founded the Positive Recovery program in 2023. And this is the premier institute for treatment of alcohol and substance use disorders across the lifespan. So not just adolescents, but also adults. He's extremely passionate about spreading awareness about addiction, treatment and its management, and reducing the stigma surrounding access to care. And this is such a relevant topic in terms of medical marijuana and the value of it, as well as the statistics. So welcome, Dr. Kumar. And Kim, are you seeing the chat? Do you want to share some questions before he gets started?
Absolutely. Thank you for being here, Dr. Kumar. It's nice to meet you. And before we start to look at some of the chat comments, I just wanted to remind everyone this is a recorded webinar, and staying on today's webinar, you're giving us your permission to be recorded and to post this to the ABIN website. So thank you for being here with us as always this Thursday morning, and let's get to it. So yeah, some positive comments, Dr. Kumar, about you and about the information that you have. They also want to learn about the current and future landscape about medical marijuana. There is a comment that patients are coming in for marijuana cards. They want to learn positives and the uses for medical marijuana. Is there anything negative that can happen when someone's using medical marijuana? And then there's a comment that they're noticing a lot of people 60 and over who are using medical marijuana and wondering about potential side effects. So those are some of the chat comments already that are in there. And I'll just try to help you watch the chat and interject with some questions along the way.
Sounds good. Thank you so much, Kim and Dr. Gibson, for that wonderful introduction. I really appreciate that. And I also appreciate the comments from the participants. I don't know all of you, but I hope to know more of you soon. So, some of your comments are very, very relevant to this topic. And in fact, I am going to talk about some of the things that you mentioned in your questions. So without further ado, let me share my slides. Actually, can someone give me permission to share my slide? It says it's disabled.
Yes, we will work on that right now.
Okay.
Yes, I've got that. 1 second. There we go. Now you should be able to.
Yep, I got it. All right. So let me go into the presentation mode. Okay. All right, great. So we're going to be talking about the medical marijuana in Arkansas, the past, present, and the future. Okay. So I like to begin with my story, and why am I even doing this talk? Why is this such an interest of mine, right? Well, like a lot of you, addiction runs in my family too. I had an uncle actually, who was a physician and who struggled with alcohol use, right? And growing up as a teenager and into my early 20s, I witnessed firsthand, what it led to and how it affected not just him, but also my entire family. We were a very, very close family, and he was my mom's younger brother, and you could see that addiction affects not just the individual, but the entire family, right? And so growing up, I was already thinking about medical school, but that kind of solidified my resolve to learn more about the field of addictions. And I came to the US to pursue psychiatry with the one goal of, working with the field of addiction and patients who are dependent on substances. Along the way, I got interested in the developmental perspective, and I realized that addiction starts very early on in life, right? And most of the adults that I was working with at the time in residency, they seem to have started using alcohol or marijuana, or sometimes even, methamphetamine, early on. We're in Arkansas, there's a lot of methamphetamine use even in teenagers. So that's what I started to see is how does addiction start and how does it progress and how does it solidify over the next decade or two of their lives, right? And so, that's kind of, my journey through this field. And, I find great satisfaction in working with patients with addiction. It's really a big passion of mine. And as Dr. Gibson said, I was at the UMS, I was at the Center for Addiction Services and Treatment for almost, more than 10 years. And so I've worked with teenagers, adults, older adults with addiction in all capacities. And eventually kind of, a couple of months ago, decided to move away and start my own clinic, which is Positive Recovery. And this is really geared towards both adolescents and adults who are struggling primarily with alcohol and opioids. And the reason for that is, we have good medications for alcohol and opioids, right? So I combine both medication management as well as group psychotherapy, because I believe medications are not the only answer, right? Sometimes you do have to, involve a lot of kind of teaching about recovery and help patients develop their skills around recovery, right? Sometimes people feel, patients say, well, I'm just going to be on medications and not even talk about addiction. It's like, fine, that will help. But what will help more is engaging in a dialogue about your addiction and what it means and how is it affecting you and how can you overcome that, right? So I combine group psychotherapy using motivational interviewing techniques, some CBT or cognitive behavioral interviewing techniques in a group setting, along with medications for opioids and alcohol. Now, I have had a spattering of patients, especially young ones, teenagers with marijuana problems, right? And so that leads to my talk about this marijuana problem. All right. So I do not have any financial disclosures or conflict of interest. And these are the learning objectives. So we'll go over some of the literature on the efficacy and potential risks. Like some of you said, we don't really know what harmful effects of marijuana they are. We hear all about the positive effects, right? And mainly from patients who say, well, I use marijuana for my sleep or anxiety or appetite or just to help relax when I'm overwhelmed, right? So you hear that from your patients regularly. But what we don't know and what the patients sometimes don't know is, are there negative side effects, right? Then we look at the past, present, and future landscape of marijuana legalization. And finally, medical marijuana has been legalized in Arkansas since 2016. And we'll talk a little bit about that. And we'll look at what has happened since then, right? How has the landscape in Arkansas changed because of those legalizations? All right. Okay. So part one, and like the objectives, I'm going to break it down into these three different parts. We'll talk about the efficacy and risks of cannabis on both psychiatric and medical conditions. Okay, all right. So let's first look at what is cannabis effective for, right? And before even I go into the actual evidence, let me tell you where this evidence has come from, right? There's a lot of data on marijuana, a lot of papers coming out even now, right? And the way the medical literature works is, a single paper is really very effective, okay? So you have to take the entire past history of a particular topic and add that information on. So any new paper that comes in, you have to take that in the context of what has been done previously, right? So a group of researchers, very, very smart people in the country, formed a committee, and they decided that they're going to look at every single piece of evidence related to marijuana and its effects, both for medical and mental health conditions. Okay. And so that process culminated in a substantial review of the literature. And then each single paper was classified based on the level of evidence. For example, good quality randomized clinical trials with the highest evidence would be something like some substantial evidence. But case reports or, small number of studies or studies with methodological flaws, right, would either be in the limited evidence or sort of insufficient evidence category, right? So these researchers kind of took all of that data and classified each individual article based on this level of evidence, right? And that led to a publication of a book called The Health Effects of Cannabis and Cannabinoids in psychiatric and mental health in psychiatric and medical conditions, right? And if you guys need the information, I'm happy to share the link to that book. But this information that I'm presenting is directly from that. And this is not comprehensive because it is a big book. So I'm kind of showing you the highlights of that. All right. So giving you the background on that, now let's see what cannabis is effective for, right? So we can see that it has substantial evidence, so good quality evidence that it is helpful for chronic pain in adults. It is also helpful for chemo or chemotherapy-induced nausea and vomiting, and then spasticity in your muscles related to multiple sclerosis. So that's where the good evidence comes from, right? There's some moderate evidence that it helps with short-term sleep outcomes. So when your patient says marijuana helps some with sleep, in the literature, what says is there is some evidence that short-term sleep outcomes, marijuana helps with. With limited evidence, and I have kind of put in bold some of the psychiatric conditions that I'm going to focus on more, right? You can see that there is limited evidence that it helps with social anxiety, especially when they did a public speaking test in a particular paper, right? They saw that social anxiety scores went down. And the same with PTSD symptoms, right? So when patients say, well, the PTSD symptoms could benefit from marijuana, well, there is some limited evidence there, okay? And then there is no evidence that it is helpful for addiction. So if you have an opioid addiction or an alcohol addiction, some people kind of use that as a reason for using marijuana. There's no evidence for that. And the same thing with schizophrenia and psychosis outcomes, okay? So this gives you a snapshot of what is it effective for, what is it beneficial for, right? And so when, especially our patients who are struggling with mental health issues come to me and say, well, marijuana helps with my anxiety. I say, okay, what I know because with the research is, well, yeah, it could, but there is very limited evidence that it helps with anxiety. Does that make sense? Okay. All right. Moving on to what is it ineffective for? What it does not help with? It does not help with dementia. So if you have some older adults, with dementia who are using cannabis, it is not helpful. It is also not helpful for improving your intraocular pressure, which is the eye pressure when you have glaucoma. It does not help with that, okay? And it does not help with reducing depressive symptoms in the context of chronic pain. So if someone has chronic pain and depression along with it, it does not help with those depression symptoms. Okay, moving on to what are the adverse effects, right? So this is important too, because that's the question you have and all of our patients have is like, does it cause any harm when I'm using it for my anxiety or PTSD or whatever it is, right? So the same kind of category of evidence, let's look at the substantial evidence. So substantial evidence that it can cause motor vehicle accidents. In females who are pregnant using marijuana for nausea, it can cause low birth weight in the offspring. And then it can, again, substantial evidence that it can lead to a development of schizophrenia and psychosis in heavy marijuana users, right? And paper after paper, research after research has shown this connection between the use of marijuana and increase in paranoia, increase in development of psychotic symptoms like hallucinations, delusions, and people who are at risk for schizophrenia. So if they have a family history of schizophrenia or psychotic disorders, we tend to see, especially in the younger population, so teenagers, let's say their first episode psychotic break would have been at age 19, which is generally around 17 to 21. If they have been using marijuana, the age of onset decreases. So they could start having those symptoms at age 16 or 15 sometimes, right? And then we know with psychosis that if you have psychosis early in life and with the use of marijuana, the severity of psychosis is worse and more resistant to treatment. So the link between psychotic symptoms and marijuana use is very, very strong. Moderate evidence, right? So again, I'm going to focus on the mental health side of things. So I see a lot of patients who are coming to me for stimulant treatment for their ADHD because they can't focus or they are distracted easily. And they're also on medical marijuana, right? And that confuses me because then I have to have a conversation with them about, well, if I'm going to use a medicine to treat your attention problems, I know that there is a good level of evidence that marijuana can affect your learning, memory, and attention. And we definitely see that in younger kids, okay? Again, in someone with bipolar, it can cause increased mania or hypomania symptoms. Social anxiety. So remember, there was limited evidence that marijuana helps with social anxiety. At the same time, there is moderate evidence that it worsens social anxiety. So you say, well, how can it help with social anxiety and cause social anxiety to be worse, right? That's kind of paradoxical. Well, it kind of depends on the studies. There are some studies that showed some evidence that it may be helpful for social anxiety. Remember the public speaking test, right? However, there's a lot more evidence, so stronger quality evidence that it actually worsens social anxiety. Same thing with depressive symptoms. So someone who has depression, it can lead to more depressive symptoms and then increase in suicidal thoughts, attempts, and completion. And then, of course, use of marijuana can lead to, and again, this is research. This is not just my gut feeling. It can lead to development of other substance use disorders, right? Then you look at the limited evidence. So I'm going to point out the severity of PTSD symptoms, right? So I'm going to go back a couple of slides and show you. It was effective for PTSD symptoms, and there's limited evidence, right? The one in the yellow. And then it causes the severity of PTSD symptoms to be worse. And again, limited evidence, right? So that's interesting too. So when someone has PTSD, should they use marijuana? Should they not use marijuana, right? Well, what we know is, there are some studies that show, again, limited evidence that it may be helpful. At the same time, same quality of evidence that it can actually worsen PTSD symptoms, right? So as a physician, whenever I'm prescribing medications, especially any medication, whether it's, SSRIs for anxiety, depression, or antipsychotics, whatever it is, right? I know that the benefits of those medications have to far outweigh the risks of those medications, right? And in this case, especially, for example, PTSD, I don't know if I have the evidence that that's necessarily true, because I have the same quality evidence that it can help, but it can also make things worse. So I'm a little hesitant to use, or see people with marijuana on, for their PTSD symptoms, just because I don't have the data yet, right? Now, there is a lot of research going on, as I said, and if the data shows one way or the other, then we may change our, practices. But as of now, I'm very hesitant and cautious about using marijuana for mental health conditions, especially because of what you see on your screen right now. All right. Moving on to part 2, and I'm going to talk about the legalization landscape. What has been done in the past? What is the current state of the legalization, landscape? All right. And I apologize, I can't see you all, so I'm going to keep moving and we'll have time for questions at the end. All right. So this is what was passed in 2016. It was the Arkansas Medical Marijuana Amendment of 2016, or Amendment 98. Now, remember, there is a difference between legalization in terms of legalization for medical use versus legalization for recreational use, right? What Arkansas passed with this amendment was that they legalized the medical use of marijuana, okay? And it was passed by a public vote. It was a 53% yes vote on that. And what that led to was eventually the Department of Health came up with this medical marijuana physician's written certification, where a physician like me who has an active license and a DEA number can authorize that a patient has one of these 18 qualifying conditions. So I, as a physician, cannot write a prescription for medical marijuana, but what I can say is, based on my evaluation of the patient, they meet one of these qualifying conditions, right? And if you look at the list of those conditions, one of the big mental health conditions there is PTSD, or post-traumatic stress disorder, right? Now, I just told you the evidence for PTSD clinically. This is the law, right? I'm actually not sure where this list came from, but maybe there were some experts that were consulted. Okay. So other than that, you have, these are the conditions which are primarily medical, like, Tourette syndrome or glaucoma or cancer. And you can see glaucoma, like, I just showed you there is no evidence that marijuana is helpful for glaucoma, even though that's on the list. Okay. And then seizures, there is some evidence that can be helpful for seizures. So anyways, the physician then evaluates the patient, basically check marks they have one of these conditions, and then they can kind of authorize the card is, register it for 12 months or less than 12 months, and they can specify 6 months or 2 months or whatever. Now, the patient then goes to the Department of Health with this physician authorization, and they pay a $50 fee, and then they get a medical marijuana card. Okay. Now, there are some limitations on use. They cannot use, it does allow for the use of that medical marijuana at their private residence, but they cannot use it in other places. For example, where you cannot smoke, or in a school bus, or while operating a motor vehicle, in correction facilities, government buildings, daycares, that kind of stuff. So there are some stipulations on or prohibitions on where you can use medical marijuana. Okay. So there are also some restrictions on the growers. And one of the things is, like I mentioned, they can get a card. They are limited to the purchase of 2.5 ounces of marijuana product every 2 weeks. Okay. And if you know 2.5 ounces, I had to kind of look this up. 2.5 ounces is the same weight as a large egg. Okay. But in terms of the marijuana product, it's a lot of marijuana. If you don't know 2.5 ounces, right? And if you go to a marijuana dispensary, you have all of these strains, all of these products, all of these ratios of THC versus CBD. And none of that says, none of those are restricted. All the restriction is it has to be limited to 2.5 ounces. That's it, right? So it's equivalent to, in my brain, right? I'm thinking, well, if I diagnose someone with depression and I say, okay, you've got depression, and you can go to the pharmacy and pick out any antidepressant, any dose, as long as it weighs a certain amount or has a certain quantity, and then you're allowed to use as much as you want, right? It's kind of hard to fathom for me, how people decide how much marijuana to use for their legitimate medical condition, right? So that's the part that kind of is tricky. And people don't understand, like, okay, once they get the product, how much are they supposed to use, right? And the dispensaries, the pharmacists at the dispensaries will tell them certain recommendations or certain strains, like this is more helpful for this versus that. And I've heard there are institutes in California or Maine that have like a 5-hour CME course on some of this. And I'm like, I'm not sure where the data is coming from. So anyways, so let's see what has happened since then, since that legalization. That was passed in 2016. Now, in 2019, there was a legislation that was proposed, which kind of proposed that the 18 qualifying conditions increased that to 57 conditions. And that included psychiatric conditions like ADHD, generalized anxiety disorder, bipolar, anorexia, bulimia, and other medical conditions, right? It did not pass. So that was in 2019. Again, 2019, there was a Senate bill that kind of put a little bit more restrictions, especially with the products, so that they don't appeal to minors. So they had prohibitions on the shape, color, taste, or design of these products, so that kids don't assume that these are candies or cookies or cakes. And so that was passed and is now a law. So those two things happened in 2019. I'm talking about the big ones. All right. In 2020, there were a couple of legislations that proposed to legalize the recreational use of cannabis. And you can see the sponsors for those, right? Now, this is a different move, right? Now, so far, we have legalized the medical use. These two proposals said that we need to legalize marijuana for recreational use. They were not on the ballot, just did not get to that point yet. But you can see the trend now, right? So that was 2020. Then in 2021, because of COVID and everything, there was a medical marijuana telehealth certification. So initially, a physician had to do an in-person evaluation of the patient before filling out that form, the authorization form. And in 2021, because of this now act, a physician could do this evaluation via telemedicine. Okay. And then last year, this was 2022, there was another proposal for marijuana legalization. This was in the news a lot. Some of you may remember this, but this would have allowed for a possession of up to 1 ounce of marijuana for adults 21 and over, and certain other conditions that you see on your screen. So, sale of cannabis, this did not pass. It failed with just 44% vote on November 8th of last year, right? And the reason I'm showing you all of this is I want you to see the trend, right? So we have already legalized the medical use of marijuana. Every other year or so, we have these proposals for recreational use of marijuana. To be honest, I believe that at some point, Arkansas will, like a lot of other states, legalize the recreational use of cannabis, right? And that's cautionary for someone like me, because I know some of these side effects, right? And not everyone who uses marijuana will have a problem. In fact, most people will not have a problem if they use it kind of recreationally. However, people with mental health issues are more prone to the negative side effects of marijuana than the adverse effects of marijuana, like you saw in the literature that I just showed you a few slides earlier, right? And about 33%, so I said 30% to 35% of people who use marijuana regularly will have a cannabis use disorder. And I'll tell you a story. I saw a patient yesterday, a prior nurse. She came to me, overwhelmed, stress, and I'm treating her for her depression and anxiety, right? And in the course of our conversation, she mentioned that she did have a medical marijuana card and she had been using the marijuana edibles for the past year, right? And she just spontaneously started reporting that the edibles that she was using, it was 20 milligram THC in it, but she because of the overwhelm and the stress, she was having to eat double the quantity. So she was getting up to 40 milligrams most days now, right? And she was feeling that she was getting addicted to the marijuana, right? And I asked her, well, why do you use marijuana? Because you have a medical marijuana card, right? Well, she initially got the medical marijuana card for her chronic pain. She had some occipital neuralgia, so she, some migraines and back pain, neck pain. And so legitimate medical condition, she got the medical marijuana card, started using the medical marijuana, right? But eventually, and she said this spontaneously, right? I didn't even ask her. She said, now my pain is under control, right? I mean, I'm on medications for my pain, but I think I'm using marijuana just to feel good, right? So what's happening is, yes, medical marijuana can be helpful for some very narrow medical conditions that I showed you, right? But you also have to consider the entire effects of marijuana, right? What it does, what it's helpful for, and what it is harmful for, right? Because if you start using marijuana as a medication, right? Remember, you are getting the entire effects of marijuana, whether it's positive effects or negative effects, right? And so you have to teach your patients, we have to tell our patients, if you use this is what it might help you with. At the same time, you may have all of these other problems, right? Your attention span may go down. You missed your reaction time, that leads to the motor vehicle crashes, right? Your development of addiction for not just marijuana, but other substances increases. So there's a whole host of things that can happen to you if you use marijuana. And you really have to consider the benefits and the risks if you use that. And we had that conversation, I had that conversation with this patient yesterday, and she decided, I think it's time to not renew my card because her card is up for renewal and you have to renew it every 12 months if it's for a 1-year card. And she said, what, I think I need to get off of this and I'm using it more than I should. And, can you help me with that? And so that's an important lesson for all of us to say, well, how do we legitimately and appropriately use medical marijuana? Okay. Now, again, with the legalization, once we legalize the recreational use, I'm hoping not, just because I'm an addiction psychiatrist, right? But let's see how this plays out. Okay. Moving on to the demographic, economic, and geographical trends in the distribution use. So this part really talks about what has happened in Arkansas since the legalization. Okay, and how has it changed the landscape of marijuana use in Arkansas? All right. So the first slide is the number of medical marijuana dispensaries. So remember, it was the law was passed in 2016. By 2018, there were kind of the licenses started being issued. And by 2019, within a year, there were 32 licenses granted, right? And by that same year, there were 6 active medical marijuana dispensaries. Okay, now you can see the licenses got up to 38, and I think they have capped the limit of licenses for the marijuana dispensaries. So the licenses have gone up to 38 by 2021. And then the number of active dispensaries has been catching up behind, and now it's up to 38. So all of the licensed dispensaries are active now as of last year. Let's look at the dispensary zones. So this is, the Department of Health have done this. They've divided the state into different zones, and each zone has a certain number of dispensaries. So it's not like, you can't have all the dispensaries in one location and not the other location, right? And this is a QR code. So if you scan that QR code from your phones, you can actually get a link to the name of the dispensaries, the exact location and their phone number, if you're interested in finding out where are these dispensaries in the area that I live in. Okay. All right. And then the next slide is the number of physicians providing written certifications, right? So as you saw, 2018 is when the dispensary licenses started being granted. So it took a couple of years for this to catch up. And so there were about close to 500 physicians who provided these authorization forms. And then that number has grown since. And 2021, 2022, it's gotten close to about 1,000 physicians every year that are authorizing, that are filling those authorization forms for a variety of conditions. It's not just for mental health conditions, but for chronic pain, fibromyalgia, whatever it is, whatever the conditions are. Okay, just to give you an idea there. Okay, this is an important slide, and it's a little complex. I'll spend some time on it, right? So 2018 is when the medical marijuana ID cards started being issued after those physician certifications, right? So you can see in 2018, we had about 5,500, 5,400 kind of cards, the authorization forms that were submitted to the Department of Health, and then they were approved, right? Now, the approval is slightly less than submitted because, for a variety of reasons, if they didn't pay their fees, or if the qualifying condition wasn't checkmarked and someone, a physician hand wrote a qualifying condition, some of those are not valid, right? And so you might see not every single form that is submitted gets approved, right? But it's close, it's very, very close. So the first two, the little blue kind of lines says that the first one is submitted in 2018, and the next one next to it, right, there is the 2018 approved kind of card, right? Now, if you look at the next year, 2019, that number doubled. So it jumped from about 5,000, 5,500 to close to 10,000, okay? In 2020, it jumped again, but by a far greater percentage. So it jumped to almost 40,000 there. And then we started seeing these orange lines, and orange lines are the renewal applications, right? So people who got the cards approved in 2019 applied for a renewal of that card in 2020. And so that's the orange graph. So if you see the numbers, it's close to 4,500 or 4,500 approved IDs in 2020. Going to 2021, that number jumped from 4,500 to 24,870. So a big jump in 2021, right? So really, if you look at the data, 2021 is the first year that people really started using medical marijuana, right? Before this, it had trickled up, but 2021 was the first year that it has really started off. And then it's 2022, and it seems like it's kind of a little less, but you see a lot of renewal applications from the past, right? And the reason I think it's a little less still is the data isn't completed yet. I'm still waiting on the completed data from 2022. So there are, for example, pending applications, especially in the caregiver category or the visitor category. And visitor category is someone who's visiting from out of state who needs a ID card here in Arkansas. So there are other categories that the data is pending. So I don't have the complete data for 2022 yet. But you can see it's close to the 2021 data. So as of now, we can assume that approximately, close to 9,000 people in Arkansas have approved medical marijuana cards, okay? And if you look at the demographic, the population of Arkansas, the adult population of Arkansas, this is about 2.6% of the entire adult population. So 2.6% of adults in Arkansas have an approved medical marijuana card. Okay. All right.
Dr.
Now,
Kumar,
yes.
someone has asked if you're going to share your slides afterwards. We can
Yes.
post on the ABAN website.
Okay, yes, I'm happy to, and I'm gonna give you my email at the very end. So if you guys email me, I will give you a copy of the slides, but also a copy of that book, the book I mentioned, as well as some of these resources. I have a kind of a cluster of resources. I'm happy to send it all to you if you email me, and I'll give you my email at the very end.
Thank you.
Yes, ma'am, absolutely. All right. So let's see, what are these cards approved for? What are the actual conditions, right? And so out of all the population, out of the 9,000 people or 8,500 people or 85,000 people that have approved ID cards, what are these qualifying conditions? You can see that a majority of them, 32.9, so almost 33%, so 1/3 of them have cards approved for PTSD, right? Now, remember the data that I showed you on PTSD. Limited evidence that it helps with PTSD symptoms, limited evidence that it makes the severity of PTSD symptoms worse. Most of these people have cards for PTSD. And then, the next several categories are chronic pain, so intractable pain, arthritis, neuropathy, fibromyalgia, and so forth. So that's just interesting to me how much PTSD is out there that people use medical marijuana for, and what the actual evidence for PTSD is. All right. Now, this is kind of a breakdown in terms of the gender. So approximately, slightly higher males than females, but, approximately the same amount, males versus females of the approved cards. By age group, some of you asked, how much of the older adults are using medical marijuana? Well, 65 and over. That's a 16%, of the population of the entire ID cards that uses. But the majority of them are in the age group of 25 to 44, and then the next big category is 45 to 64. So we still have a significant number of older adults in Arkansas that have the approved medical marijuana card. All right. By race, almost 77%, 78% of Caucasians have these cards. African Americans are about 8%, and did not answer was about 13%. And then this is a distribution by the state. And this is all 2022 data, so last year's data. And this kind of is based on the population too. There's a lot of population in Pulaski County, in Benton County, Washington County in the Northwest. And so you can see that more cards were issued, so close to 10,000 cards, close to 11,000 cards just in Pulaski County alone. Okay, and then the next numbers are in Benton and Washington counties. There's a spattering of them around the state. Okay, and then kind of zooming out to the entire country, this is where the legalization stands in the country, right? So Arkansas is one of those states which have legalized the medical use of marijuana, and all the states in the light green have legalized the medical use. All of the states in the dark green have legalized the medical and recreational use of marijuana. States in white or gray, they have no laws related to marijuana. Okay, so that's where we stand. And I have tracked this graph, this exact map, for about 5 years now. And every year I see this, this green spreading. Let's just call it that. Okay, now here's the problem, right? We have seen an increase, a significant increase in marijuana from 2011 to 2021. So if you take the 10-year span, it really started kicking off. And this is not just Arkansas, this is the entire US. This is from NIDA, right? And so we have seen a significant increase in marijuana use, which is the top blue line, in the entire country, just because of those legalizations. Now, Arkansas legalized it in 2016, but some of the states have legalized it, years past, and sometimes decade past. And so we have to be careful of, the amount of marijuana going up. And as I said before, not everyone who uses marijuana will have a problem, but about 1/3 of them will have significant problems. Also, especially the older adults, right? So people 55 and up, right? The marijuana that is available now is different than the marijuana that you used back in the 60s and 70s, right? You're not using the simple plant products anymore. Yes, it may be plant products. However, the concentration of THC, which is a psychoactive compound in marijuana, which is tetrahydrocannabinol, is much, much higher. I mean, in fact, we've seen easy upwards of 15 to 20% THC content compared to the previous regular plant product that was back in the, the 80s that had about 3 or 4% THC content. So it's more than 10 times the THC content in the marijuana that's available now on the streets or in the dispensaries. Okay, so you do have to be careful of the amount of that. And being a child psychiatrist, I work with kids, and I want to keep that data in mind. So this data is from the Arkansas Prevention Needs Assessment Survey. And what this survey does is they look at kids in 6th grade, 8th grade, 10th grade, and 12th grade. So middle school and high school kids, right? So if you look at the graph, and this is from the left, it's 2016 to 2021 data, right? The top line is 12th grade, then the green line is 10th grade, then 8th grade, and then finally the bottom line is 6th grade, okay? So high school to middle school, top to down, all right? You see that the marijuana rates were kind of trending down, 2016 to 2019, 2020, it really dropped for the 12th graders. But then in 10th and 12th graders, I see that slight uptick in the marijuana use from 2020 to 2021 in both 12th and 10th graders. Now, what does that mean? Well, first, let me talk about this thing called perception of harm of marijuana, right? And perception of risk, perception of harm, perception of risk, it's kind of a similar thing, right? What happens is if I were to ask you, what is more dangerous? Methamphetamine, cocaine, alcohol, or marijuana? Well, it doesn't matter what you think is more harmful, right? What matters is what you really think is more harmful, right? And that's basically perception of risk. So take a teenager who's 15 years old and you ask them the same question, right? What would they say how harmful marijuana is? And this survey asked that same exact question. So let's see what the kids said. The blue line shows when the kids were asked, how much is great risk when you smoke marijuana regularly? That's the blue line, and it goes from 2012 to 2021. You can see that their perception of great risk from smoking marijuana regularly has trended downwards. Okay, same thing with the kind of the yellowish line, which says trying marijuana once or twice. Even that perception, even trying it once or twice, is trending downwards, right? We know from previous data that when perception of risk is lower for a substance, the use of that substance is higher. Does that make sense, right? When perception of risk, when I perceive marijuana to be less harmful, I intend to use more marijuana. I actually end up using more marijuana, right? And we are seeing that every day in our teenagers, right? This perception of risk is going down. And that's what I'm worried about in the top slide, is that slight uptake. Okay. Now remember this graph that I showed you earlier, right? We really saw an increase in the ID cards being issued, a big increase in 2021. Okay. And from the graph on the top left, you can see that there was an uptick in both 12th graders and 10th graders in 2021, right? I'm going to be watching this data very carefully to see if the marijuana cards that are being issued primarily to adults in Arkansas trickles down into more marijuana use in our 10th and 12th graders. And that is so concerning to me, because what we know about marijuana is our bodies have marijuana endocannabinoid receptors. That's where marijuana works at, right? And proper amount of endocannabinoid receptors and their functioning is so important for brain maturation and development, right? It helps with neuronal migration. It helps with neuronal pruning, right? And when you overload that system with externally used marijuana, whether it's smoked or edibles or whatever it is, right? We have started to see, again, that those strong links with psychotic symptoms, those strong links with social anxiety, those strong links with paranoia, even in teenagers who are using marijuana regularly. So I hope it doesn't, I'm gonna, like I said, I'm gonna be watching this data carefully to see where things are, right? So in summary, again, I'm kind of summarizing just the substantial evidence of effectiveness and adverse effects. So there is evidence of effectiveness for chronic pain in adults, for chemotherapy-induced nausea and vomiting and spasticity. At the same time, there is substantial evidence for motor vehicle crashes because marijuana decreases your reaction time, your concentration, your ability to kind of look at the red light, the driver on your left side, and kind of pay attention to all of that when you're high with marijuana. And finally, the development of schizophrenia and psychosis. Okay, so we need to watch for the bills that are introduced in the legislation, kind of educate our patients about that. We need to follow the trends in the medical marijuana fiscal year reports. And again, I'm going to give you my email in the next slide, and I'll give you some of these trends. There are papers that are published every year, and I have compiled them, so I can kind of just shoot it out to you in an email. I'm going to monitor, I want you to monitor for trends in marijuana use, especially in adolescents and young adults, and also in our older adults, right? The one above 55 years of age. And finally, kind of correlate what your experience has been with the increase in marijuana rates in the community, as well as the rates of psychiatric disorders, depression, mania, and especially psychotic disorders, right? So we can all do a better job of keeping track of all of these things. Okay. I do want to acknowledge Dr. Ron Thompson from UMS. We both kind of share our slides, and so we kind of go back and forth with the data. And so I'm very happy for his collaboration and his direction. And these are my bibliography and some references. And finally, that's my email. It's nkumar, my last name, Kumar, at Positive Recovery Arkansas. So AR, positiverecoveryar.com. But if you look up Positive Recovery Arkansas and search for it, our website will pop up. Our website is positiverecoveryar.com. And that's where I'm located at. So I'm very happy for you guys to, if you have patients that are struggling with substance use issues, marijuana, alcohol, opioids, I'm happy to see them in my clinic. I do both a combination of substance use. My primary focus is substance use, but if you have depression or trauma or anxiety or something else that I can easily manage in my clinic, I usually give them prescriptions. I evaluate for all of those, and I can manage that too. So it's kind of a comprehensive evaluation. Like I said, I do both the medications and the therapy part of it. So I think we have 10 more minutes for questions. So I'm going to unshare my slides and open it up for any questions. Hope this was helpful.
Dr. Kumar, this was so helpful. Thank you very much. And what a resource. Thank you for sharing about your clinic, Positive Recovery here in Arkansas. That'll be a resource for all of us. There definitely are some questions in the chat. I want to give everyone an opportunity to unmute themselves as well and ask their questions. And I'll start with the first question in the chat. Actually, I think it was a comment. It was the APNA assessments are done in schools, so it probably didn't get as many surveys completed in 2020. We all know we had the public health event. Could that give a false drop in the numbers?
Absolutely, and that's a great question. I actually did not know how much they could have collected. I do know that sometimes surveyors can send these questionnaires online or to the families at home. So yeah, that's a great question of how many of these surveys were done in 2020 and 2021, right? My guess is with a public health emergency like COVID that happened, we would have had less surveys filled out than more, right? And so I'm just assuming that there is less data. And even that data showed a slight uptick in the marijuana use, right? And in 2021, so we are kind of not that far from the beginning of COVID, a year out. And if you're already seeing an increase in marijuana use, like where are these kids getting the marijuana from during the peak of the pandemic?
That's a great question. Yeah. Okay. And then we had another question. It says, since there are so many PTSD reasons for the medical marijuana card, do you think that the providers are selecting PTSD as a reason to qualify the patient for the medical marijuana card because the patients are coming to them seeking a card but they may not have another type of diagnosis that would qualify them. And it says most everyone can say they've had some sort of trauma in their life. So do you think that this is maybe a default or disproportionately high choice of a diagnosis for a medical marijuana card?
I'm so glad to the person who asked that question. I don't know who you are, but I'm so glad you asked that question. There is a lot of different angles to it. So I'll tell you, I'll attempt to kind of cover this from the top few angles. Okay. So from a provider's perspective, we all know that our diagnoses are based on symptoms, right? So if I have a person sitting in front of me and they're really reporting symptoms, I have no way to verify, because this is a very subjective symptom reporting, right? So now we all do as providers a very good job of assessing and asking questions, right? So I would hope that whoever is filling out those cards can do a good assessment. Now here's the angle. A lot of these cards are filled by non-psychiatrists who have diagnosed PTSD. And I've known that, right? I've known family physicians, and nothing against any of these people, right? But, I would say psychiatrists deal with mental health, but, family physicians, yes, they are very good at mental health conditions, but psychiatrists are the experts, right? Same thing with like nurse practitioners, so I mean, I have known surgeons to fill out these forms, so there's a difference in the specialty level, right? PTSD can be easily missed if you don't know how to appropriately diagnose it. So that's from the provider's perspective. From the patient's perspective, I have heard from some of my patients directly and from a lot of providers indirectly that patients just want to smoke marijuana because they feel good, right? So they will come to you, they will come to their providers asking for a diagnosis of something. There are patients who I've seen last week, when I've done a mental health evaluation and they meet criteria for anxiety, and then I figure out, well, they're using marijuana. I'm like, okay. So I ask them this question every single time, like, what is the qualifying condition for your medical marijuana? And they're saying PTSD. I'm like, well, but you don't have PTSD. You don't have history. I mean, I just finished the evaluation, right? And then they were like, oh, well, you know what I mean, right? And so it's kind of like, well, I know from firsthand experience that a lot of these patients don't have that particular diagnosis and still have the medical marijuana card. Now, asking patients, they will tell you that approximately half of the people who have medical marijuana cards just use it for recreational purposes, right? And so it's kind of like, well, we all know what's going on. It's not just a suspect anymore, right? But that's where it plays into the fact that people are going to do what they're going to do, right? And again, we have to be careful and diligent about what we can do in this situation, because we don't want this to become an epidemic of psychosis or paranoia or, people's anxiety getting high just from the marijuana contributing to that, right? Now, I don't know how big or little of a problem this is going to be, especially if it's legalized for recreational use. But that's my worry, because I'm going to see a lot of patients and treating patients with marijuana, it's not that easy. I mean, it is hard for patients to get off of marijuana, right? And there are no FDA approved medications. I try gabapentin or I try N-acetylcysteine or something else. And it is still hard because there is a very well-defined cannabis intoxication syndrome. There is something called a cannabis use disorder, like an alcohol use disorder or an opioid use disorder. And it has very specific withdrawal symptoms if you abruptly stop. So it fits the classic picture of an addictive substance, right? Just because you have a medical marijuana card. Like I ask this of my patients, what is the difference between marijuana and medical marijuana? Well, none, right? It's marijuana, right? It's just that medical marijuana protects you from the criminal penalties. That's all, right? You're not criminally penalized. Like you can't be arrested if you have appropriate amounts of medical marijuana using appropriate. That's all, but it's all marijuana. Well, I'm hoping that it's better quality marijuana if you're getting it from a dispensary too. So, but I don't know if that solves the problem. So thank you for that question. And I know we are kind of getting, I can answer a few more questions, but if you have more questions, email me those questions. I will look at every single one of your email and answer those questions. So
we really appreciate you taking the time to offer people to email you questions. We had another question, which is there any information to indicate the percentage of placebo effect on medical marijuana? Excuse
Of
me.
medical marijuana. I have not seen any literature on the placebo effects because it is very hard to do, research in marijuana has been very hard. And even now it's hard because it is still a Schedule I substance according to the federal government, right? So now the research, so you couldn't even do research. Like, how will you give someone medical marijuana or a marijuana product when it's a Schedule I? Right? So researchers have no access to the marijuana product. You see what I mean, right? So you cannot do head-on-head trials to see the placebo effect. So I have not seen any placebo numbers coming out of the literature yet. Now, those research barriers are breaking down a little bit. There is a little bit more, everyone wants to do more research in marijuana. And so researchers are having more access to actual marijuana samples that they can use that for research purposes. And so my hope is in the next 5 or 10 years, we will start to see some of that data.
And I think we have time for one more question. Let me ask, are we seeing the increase of psychosis and other negative impacts of cannabis in other states that have legalized marijuana for recreational use?
Yes, in fact, we have started to see some increase in psychosis. So the data is mixed right now. As I said, this is new data, right? And so we have to be cautious about just 1 or 2 papers that are out there. And some of those papers have shown an increase in risk, right? Like I mentioned when I was talking about psychosis, almost every paper that has looked at marijuana use and psychotic symptoms have found a correlation. So it's almost always positive correlation that marijuana use leads to more psychotic symptoms. I mean, in the recent years, I have not seen one paper that shows me otherwise. So especially from a psychotic perspective, a psychotic disorder perspective, you need to be very, very careful of marijuana use.
Okay.
Quick comment, and I don't know if this is a quick answer, is do you have a quick comment on CBD oil and CBD?
Yeah, that's another wonderful question. So it seems like the CBD, so CBD is technically the non-psychoactive component of the marijuana, right? And it could be helpful for anxiety or sleep or some other things, right? So potentially, yes, it might be helpful and might be better than the THC products, right? Again, the data is still coming out. So I'm going to watch for that data in the next few years. One of the problems I run into currently is I've had now a couple of patients who started using these CBD tinctures. They put these drops in their mouth, right, for sleep, and it helps them relax. And they verify, like, this is 100% CBD that I'm buying from a medical marijuana dispensary, and that's well and good, right? When I've done urine drug testings on them, because that's what I do at my clinic, right, they're invariably positive for THC. So the problem is, even the people who are selling these products that they think is 100% CBD, why is a patient positive for THC, right? And they're positive, which means there is THC in the product. So there is no FDA regulation on these products. You have it on the manufacturers to kind of regulate that, and it's kind of almost duping your customer, thinking that they are selling them 100% pure CBD product, whereas it has some THC content in it. And again, there is no regulation. Like, we cannot verify the product that you're using has what and what ratio and what concentration. So you basically have to trust the label on the product.
Wow. Okay. Well, I know we are a little after. We really appreciate you, Dr. Kumar, answering all of these questions. Please know if your question didn't get answered, or if you leave today's webinar and you start having some burning questions about this information, you are able to email Dr. Kumar and we can get those questions answered. We appreciate your time, Dr. Kumar, and thank you all for being on with us this morning. In September, we are going to be having Verna Little as our guest speaker, and she's going to be talking about the collaborative care model, the nuts and bolts of collaborative care. So we hope to see you then. Everyone have a great day. Bye-bye.
Thank you all. And thank you again, Dr. Gibson, for inviting me, and Kim for approving this. Appreciate you all.
We appreciate you coming today and taking the time out of your busy schedule.
Absolutely. Happy to do it.
And I'm
Excellent.
so glad to learn about your resource, Positive Recovery. We
Yeah.
we have a opioid use grant, and
Okay.
we're always looking for places to send patients and potential resources that we can connect with. So
Absolutely. I'm actively looking for patients right now. So please send me those patients.
we will do it, and we will advertise in our rural communities, because I think a
Yeah.
lot of times what happens is people don't know where to go, right?
Mhm.
Talking to primary care, they're screening, they're identifying, we have these patients with needs, where do we send them? And now we'll be
Right.
able to say, Dr. Kumar.
I appreciate that. Thank you. All
Thank
right.
you.
Thank you so much.
Bye.
Thank
Bye-bye.
you. Bye-bye.